Hello everyone, my name is Lamia and today I'm going to be proposing a pyrolytic carbon and silicone copolymer deposit for elbow joint prostheses. I'll be talking about in vitro mechanical properties testing, in vivo short-term and long-term studies in a canine model to determine whether the mechanical and biological properties of the material will work for elbow prostheses. The picture on the left shows a typical total elbow arthroplasty implant. Presentation is broken up into 4 parts. I will begin by talking about the motivation for this proposal and focus on why it is important to talk about elbow arthroplasty. Total elbow arthroplasty is more common than ever, although there was a dip in cases requiring elbow arthroplasty in the recent past. There is a growing trend, and this is mainly due to TEA initially being developed only for end-stage rheumatoid arthritis, but it is now also being used to treat unfixable elbow fracture, osteoarthritis, and post-traumatic arthritis. Due to the number of cases requiring TEA being a lot lower than knee or hip arthroplasty, there has been a lack of research in this area. Next, I will be talking about the current state of the art used to treat elbow arthroplasty and the material used. I will also go over some issues with the material. Non-surgical methods of treatment are attempted for elbow arthritis before surgical methods. Examples for this can be seen on the slide. Surgical methods are used after the non-surgical ones have failed, and there are various types of surgical treatments such as TEA. The surgical treatments are performed based on patient age, activity, movement level, and severity of arthritis. There are 4 popular designs used for TEA implants, which are the unlinked design, linked semi-constrained design, semi-constrained condylar bearing design, which is similar to the unlinked design, and the convertible design that is basically converted between the linked and unlinked designs. Most of the implants are made from titanium, which is basically an alloy containing titanium, 6 aluminum, and 4 vanadium. But unfortunately, there are some issues with the material, which are infection, aseptic loosening, instability, periprosthetic fracture, and wear. I will now talk a bit about the background of the material I am proposing, which is PYC, and why I think PYC and silicone will make a good copolymer. I will also talk about 3 experiment aims or strategies to determine if the material can successfully be used as a deposit on titanium for TEA. Pyrolytic carbon is a carbon material deposited from gaseous hydrocarbon compounds in suitable underlying substrates at temperatures ranging from 1000 to 2500 Kelvin. The process is called chemical vapor deposition. The image shows a visual of the process. This process is used for depositing PYC onto metals. Carbon materials such as graphite and ceramics. They can have different microstructures depending on conditions like temperature, concentration, and flow rate of gas, and surface area of the underlying substrate. As the elbow joint will be replaced in TEA, it is essential that PYC meets the biological, physical, and chemical properties of the joint for it to function well post-operation. PYC is one of the most commonly used material in heart valves, as shown. Great mechanical properties such as high cyclic stress, durability, and biocompatibility. It has also been used in metacarpophalangeal implants, which is required when rheumatoid arthritis affects the metacarpophalangeal joint in hands, and results over 16 years have shown improved degree of motion, low revision rate, a high prevalence of joint stability, and virtually no evidence of wear of the implant. These studies show that PYC pyrolyzed on a suitable surface could potentially be a solution to the leading issues observed in titanium implants. Moving on to silicone, it is a material that is being used in the human body for breast implants, joint implants, heart valves, etc. for a long time, and can be pyrolyzed with PYC to improve durability by reducing brittle nature of PYC. The first aim of the study will focus on determining the percentage of PYC and silicone pyrolyzed on titanium that will provide the best microstructure and mechanical properties. Samples containing 0 to 100% of PYC and 100 to 0% of silicone copolymer in increments of 10% will be created. The microstructures and thickness of PYC and silicone on the substrate will be adjusted by changing temperature, flow rate of gas, and surface area of substrate to produce the best mechanical properties. Raman spectroscopy and electron microscopy will be used to study the microstructure of samples. Mechanical properties such as fatigue, wear resistance, tensile strength of samples will be studied to determine the best combination of PYC and silicone. Different methods mentioned on the slide will be used to perform these tests. All of these tests will take place in vitro. The second aim will focus on a short-term in vivo study to determine biological compatibility of the biomaterial in a canine model. The study will take place over 6 weeks with data collected every week. The canine models will be studied for signs of infections, inflammations, and limbs externally. At the end of the 6-week time frame, autopsies will be conducted to confirm external observations by looking for any visible internal clots, inflammations, and alterations in the synovial membrane of the surrounding tissue when observing under the microscope. Biocompatibility will also be studied by creating a cell culture using the graft and conducting cytofluorometric evaluation and protein adhesion to implant, which is basically a process in which a sample containing cells or particles is suspended in a fluid and injected into the flow cytometer instrument. The sample is focused to ideally flow one cell at a time through a laser beam, where the light scattered is characteristic to the cells and their components. Lastly, a long-term in vivo study will be conducted in a canine model to test for bone implant incorporation, range of motion, and receptive releasement. The study will take place over 16 months with data collected every 4 months. Radiographic assessments will be done to study bone implant and metal copolymer interfaces. Range of motion will be studied by measuring mean flexion, extension, and exclusion angles, pre and post-op, and results compared over time. Aseptic releasing will be studied by characterizing bare debris, which will be done using isolation techniques. For isolation technique, histological sections of bone implant will be evaluated under transmitted and pulverized light. This will help identify particular debris and cellular reactions with the implant. Also, a reason for selecting the canine model was that the mutations of osteoarthritis in dogs and humans are the same, and it includes the elbow. Finally, a conclusion of this proposal. Properties of PYC and silicone and their current uses show promise for using it as a deposit material for elbow implants. As part of this proposal, mechanical testing such as fatigue, tensile, and wear tests will be conducted in vitro to determine the amount of each material to be used to create the copolymer. Biological testing will be conducted in vivo to determine blood and biocompatibility, and a long-term usability study will be conducted in vivo to ensure proper bone implant incorporation, range of motion, and aseptic reasoning. Thank you for your attention, and now I'm happy to take any of your questions via my Canvas discussion